Alright guys, it's only been a few minutes since the abrupt cutoff of my last video. Quick update on baby bunny. I've got him set up right now in a box with heat. It's gentle heat, okay, so the box is partially in the heat lamp, partially out. It's going to get warm this afternoon, so in a couple of hours I'll come down and check and make sure he's not overheating. I don't think things are going to go well for this little guy. I'm not sure why he suddenly decided to start screaming while he was under feet, right? So I had been standing there for about 10 minutes and he was silent. So I think, the reality is he was probably injured earlier. And the screams, the whining that we heard at that point were the end of days type of call versus a help or distress. But for now, baby bunny has the absolute best chance possible. And in fact, stress is one of the bigger killers of bunnies when they're ill. So for now, best bet is not to try and transport him anywhere, not to try and race him anywhere, but see if he'll stabilize. His breathing is off. God, it's like talking about Hugo. His breathing is off a bit, but that could just be stress. He did have blood coming from his nose and his mouth, which is not a good sign. And again, bunnies are extraordinarily delicate. He's not a baby. I checked around, there's no additional friends. He didn't come out of a nest. He was probably, he's a young bunny to say the least, and probably just didn't do well with the predators around the farm and found his way to a safe spot to either recuperate or pass. So he's tucked into a nice little box with clean bedding. He's got heat. He's got everything he needs to support his body recovering. And now we're going to wait and see if his body is going to recover. Meanwhile, what is that dog doing? Oh. What are you doing? Why are you knocking food bags down? Is there something else back here that I need to know about? It's chaos. It's always chaos. Guys, this is an unscripted channel. You get what you get. So let's, Tonka, can we not? I'm having a conversation here. Fanta's got her smile on for the day. She's missing half her teeth, but she's still got a smile. All right. So let me finish the Hugo story, right? So I don't remember exactly where I left off, to be honest with you, but it was somewhere around the radiologist reading the x-rays. The radiologist didn't see any pneumonia or any signs of pneumonia whatsoever, which is good. He's full of air, all the things that make it difficult to breathe, but really no identifiable reason that was immediate. They did note that they maybe see some sort of mass on his larynx. It didn't present as a mass. They weren't really sure, but the recommendation was to do a laryngeal exam, right? Which essentially means you sedate the dog and you just take a really deep look down their throat. It's not an endoscope. It's not full anesthesia. It's just by sedating the animal, you allow yourself, the vet, to be able to take a much better look at all the things that are happening in the back of the throat. So, at this point, we did the normal things, right? We had an x-ray, we did a complete blood cell count. His white blood cells aren't elevated. There's no infectious processes. There's no signs of infectious processes. There's no organ issue that's identifiable that would cause him to be in distress like he was. And for it to be so sudden and rapid, it keeps coming back to this BOAS, brachiocephalic obstructive airway syndrome, which feels weird to have been presenting at this point in his life in this age. So I went ahead, I said, listen, obviously he needs to be hospitalized. He can't come home. He needs the oxygen support. So that's a no-brainer. He's staying. The next step is, once he's stable, go ahead and do the laryngeal exam. Let's make sure and rule out that that isn't a mass that you're seeing. And while you're there, go ahead and look at his palate. The soft palate is what's part of this BOAS syndrome, where it's too long for the short face that they have, and it actually blocks the airway. And that's kind of the whole problem with that syndrome. Is it's just, the soft palate becomes too long, and it blocks their airway because it literally gets kind of sucked down into the trachea and becomes almost a cork, right? Instead of what it normally is in your body and everybody else's normal body. It's just part of your anatomy, and there's no flapping. It's it's attached appropriately, all that fun stuff. I'm not being very scientific about it. That's kind of the simplest way for me to describe it. Again, kind of still made no sense to me, because I'm like, how could he live 9 years without ever showing a sign or a symptom? He's seen so many vets over the years. None of them have ever noted any problems with his breathing. He gets an annual exam every year. His heart is checked. I mean, there's just, how could we have missed this for so long? It still wasn't making sense to me, but I said, go ahead and do it. Call me when that's done, and we'll take it from there, right? Because next steps after that are kind of vague. If it's not a tumor or not a mass, and he doesn't have an infection, then there's really no other diagnostic tool at that point to say, well, what's causing this crisis? So she was able to sedate him, give him the exam. And of course, when he's fully sedated and intubated, he was much happier, right? Because his breathing was being done for him, and he was, much happier, healthier, etc. So the results of the exam are no mass on his larynx. Happy day. Awesome. So that was last night's news. And again, I'm not even sure, now that I had this whole bunny crisis happen, where we are in the timeline here, but it's within the last 48 hours. So when I'm talking to you about last night, it's my last night, not necessarily when you're watching it. Just so I'm, full transparency, right? So she did note that he has an extremely elongated soft palate, and, still is firm in the belief that it's, this brachiocephalic obstructive airway syndrome, BOAS, and that he's going to need surgery to correct that. And, in my mind, I'm like, all right, well, I'm not sure I believe that, but the next steps at this point are unclear, other than he needs to stay in oxygen because he's not stable, and we need a plan, and there doesn't appear to be a method for medical management because there's nothing to treat. There's no infection, there's no cancer, there's no organ issue, right? What are you treating? You can't treat anything. So, anti-inflammatories and supportive care overnight until this morning. Hopefully, the specialists will be able to look at them, both the surgeons and some of the specialists that weren't there last night. Very similar to the situation the last time he was there, right? They'll take a look at him and his case, have a discussion, and get back to me this morning. So that is what I'm waiting on now. Although I've done... What are you doing, Rennie Wren? I've done plenty of research last night. Got no sleep, of course. And yeah, I guess the reality is that everything that I've read and been able to research, and no, I don't Google, I don't do Dr. Google, I actually go to the medical text because I'm a geek. So I'm in the medical texts, I'm in the veterinary manual, right? The information is that, yes, normally this syndrome is extremely detrimental at a much earlier age, but, bless Hugo's heart, right? He's just been such a trooper about it. It's never been an issue. His body has overcompensated for the fact that his airway gets blocked on a regular basis. And part of that is, the amount of exercise that he gets, right, over the years running the farm with us and being active with us, right? He's not a couch potato, even though we call him a potato. So part of it is that. Part of it is the fact that we've never allowed him to get to be a chunky potato. He's always been extremely healthy weight and body condition. And I try and do that with all our animals, Denali notwithstanding. We don't overfeed. We don't give them treats, that yes, they sometimes get treats, but like it's not a regular part of their day. And so their weight management stays spot on. So, the combination of just, his good overall conditioning and his ability to be somewhat athletic, and it's funny to call a Frenchie athletic, but that's kind of what he is, has kept him completely able to compensate for this syndrome that he has for years. And then it appears, again, I have to talk to the surgeon, but my belief now, based on my research, is that the bout of aspiration pneumonia was sort of the trigger and the end of his ability to compensate for the condition. He is now at a point, right, where his airway has been compromised. The tissues are, irritated, and he can no longer compensate for it. A couple of things make a whole lot of sense now that I've done the research, which is, this instantaneous onset is effectively happening because his, palate has been sucked into his trachea and acted as a complete and total blocker. And he isn't pushing it out, right? His tissues are irritated, they're inflamed. His body is unable to fight through that. I don't know that it's the same premise as sleep apnea, but it feels like it's the same type of thing, right? I don't think it's the same cause, right? So don't come at me in the comments. I'm not a doctor. I'm just trying to come up with comparisons that make sense. In my mind, that comparison makes sense, right? It's sort of that ability to, breathe unobstructed, and now he's lost his ability to compensate for that. And part of that is his age. Part of that is the bout of pneumonia he had 6 weeks ago. And I think that's just where we're at. So I don't have answers yet. I'm hoping that in next hour or so, hi ladybug, I will be, I'm hoping that in the next hour or so, hey, I will be hearing from the surgeon, the doctors, don't make me walk away, and getting an update on a plan. If the plan is surgery, he'll obviously be hospitalized for a while. And surgery is serious at this point in his life. And I do have to think about that a little bit. So that's what I have to talk to the surgeons about, right? Are we going to put him through this for, what's the prognosis in terms of lifespan? But, right now it all reads kind of good. It's actually a quick recovery. My understanding, because of the tissues involved, right? If you think about, like, if you've ever bit your tongue or your cheek or whatever, it heals really fast. It's the same thing with this. So they, effectively they shorten the palate so that it stops blocking it's a soft palate, I should be specific, I guess. So it stops blocking the airway. And it's stitches, right? But it's a wound that heals very quickly just based on where it is in the body. So my understanding is it's like a 48-hour, 72-hour recovery period. And then given how conditioned he is and how much better he'll feel, there's a good possibility that he could take the Frenchie lifespan and throw it out the window, right? And we could have 3, 4, 5 more years with him. 5 is probably ridiculous. I don't know that we'll get that long. But it's not like we're at the end of the tunnel if this is truly the case. And thankfully, with all the diagnostics we've run recently, we know that. There's no cancers. There's no looming issues under it. And of course, you can't predict the future, but as of right now, minus this issue of not being able to breathe, he's a perfect specimen of health. So that is the full story of Hugo. I'm sorry it got cut off in the middle. That was not the intention. I will, next video, I'll come down this afternoon and hopefully have an update from the surgeons and give you, the next segment of the saga with Hugo and check in on our bunny. I am purposely not in the barn and not checking in on him because, again, stress is almost more detrimental than injury. So the more quiet time he can have, he's got warmth. He doesn't need water. He doesn't need food right now. He needs warmth and quiet and safety. And he has all of that. And then, depending on how he does, if he's starting to recover a bit and starting to stabilize a bit, then we can talk about, do we need to bring him to a rehab center, or can he recover here and just be released on the property, which would be the more ideal place for him. Our rehabs are overrun at this time of the year, so if it's something that we can manage here, we'll manage it. But he's got to get through these next couple of hours, and that means I have to leave him alone. So that is where we're at right now. And, if you've hung in there this long, I appreciate you staying with me and listening and learning along with me, because this is a new one for me. We're learning together. And until next time, as always, there's work to be done, but there's also naps to be had if you're a goat or a pig. Look at Miles down there. Can you see him? There are naps to be had. I have bored him to the point that he is taking a sun bath. All right, guys. Bye for now.